My name's Alison Comett. I'm one of the Macmillan Head and Neck Specialist Nurses. We are involved with your care from diagnosis, so you will meet us at diagnosis so that we can support you through whatever next treatment plan or management plan takes place. At that initial appointment, what we'll do is we will find out a little bit more about your background, what support is at home, just so that we can identify at that point if there's anything that we need to put into place to help you through whatever happens next. That can include sort of like your social circumstances, financial circumstances, your work life, anything really. At diagnosis, you'll have the diagnosis. What happens after that is that we will probably do some scans. If they've already been done, then it'll involve us discussing you at a multidisciplinary team meeting. That includes our surgeons, our consultant surgeons, our consultant oncologists, our pathologists, our radiologists, specialist nurses, speech and swallowing, and dietetics are the main people who will be at that discussion. But that's so that we can discuss any new cases that are coming through and what the management plan will be. And then what happens after that is that we will then bring you back to a clinic to discuss what the next plan of action is. That might include surgery, radiotherapy, chemotherapy, immunotherapy, or it might be a combination of some of those. But that will all be discussed with you at the next clinic appointment. Yes, we will be present at that clinic appointment so that we can discuss in more detail what that management plan is. And then at that point, what we will do is we'll probably identify other people that will be involved in your journey during that management plan and whether we need to be involved. It might be that actually we take a little bit of a back step at some point. We won't be present at all of your appointments, but we will be sitting in the background knowing what's going on so that at least we can be signposting if there's any need there. But equally, if you have any queries or concerns, then you can contact us at any point. We are available Monday to Friday, usually from about 8 o'clock in the morning till about 4:30, 5 o'clock, and we'll give you a direct number at the time of diagnosis so that you can contact us. We have an answer machine in the office as well, so that if ever we don't pick up that phone, please do leave a message and we will get back to you. I would say that your meeting of people can be through your own pathway, sort of like as you're going through your treatment. Generally, people can sort of like get their own little networks, but there is the Holistic Centre that we can signpost you to as well, that will help you through that. You can talk to people over there as well. There's some support sort of like mechanisms through our clinical psychologists, and also there's a few sort of like local support mechanisms again that the Holistic Centre can signpost you to. We can signpost you to the Macmillan Information Centre to look at the possible financial support. Not everybody is entitled to benefits when you have a cancer diagnosis, but there are some benefits and there are some grants available out there. So what we will do is signpost you to the Macmillan Information Centre because there are benefits advisors there that can help in more detail. They're the experts in financial support. During your treatment, some of these treatments are as an inpatient, some are as an outpatient. So, and not everybody requires community support. Again, that's something that we will identify from the diagnosis point, but also as we're going through treatment, whether things change and we do need to involve community support. That might be community district nurses, it might be community Macmillan nurses, depending on what the need is, but we can actually link in with those at that point as well. Whatever that journey is, sometimes it can be really quite tough, but that's why we have a number of different disciplines, including sort of like nurses, speech and swallowing, dietetics, our oncologists, our surgeons, so that we can support you as a whole team, because it can be quite tough, particularly with head and neck cancer, because if you think about everything's to do with the mouth is the access to the rest of the body, so it can affect a lot of things with your eating, your drinking, your swallowing, and that's why we have to use a multidisciplinary team to help you through that treatment plan. Yeah, initially it's sort of like us that starts that conversation, so it's really important that, you know, if you are struggling, that you do tell us, you know, so that we can at least start talking about, you know, what the issues are, and then we can look at other people. We have clinical psychologists who can help you through sort of like difficult times. They have special sessions that they can do with you. We have the Holistic Centre as well, who have counsellors, who have complementary therapies that sometimes help as well. And we do actively encourage you to use those services if you feel that that's something that would help you. It is a hard journey sometimes, but if you just follow the advice as you're going along, please try and stick to what we're advising, and it will help you get through there the other end. Macmillan found us really. They changed their role many years ago, where they wanted to support people from a cancer diagnosis, not just historically what they were known for in supporting people in the community at the end of life. So we're hospital-based Macmillan nurses, and you'll see a lot of Macmillan specialists within a hospital-based setting now. We don't go out in the community. We're here to support you through sort of like a management within a hospital base. So they adopted us many years ago, and that's where we came. But it helps us, we can access more information now because we're adopted by Macmillan, but they also help us with our education over the years as well.